Hello everyone. Welcome to today's special session on spine health. Back pain and spine issues become quite common as we grow older. But today we have two expert surgeons with us to help clear up doubts and share simple tips to keep our backs straight and healthy. Please join me in welcoming Dr. Hamza Shaikh and Dr. Nikhil Jain. Both of these experts bring extensive experience in spinal surgery and spine care, ensuring they provide the highest quality advice, treatment options, and surgical expertise. So it's a pleasure to have both of you here. Yeah, great. So now I will ask some quick questions and you can give very simple, easy to understand answers for our audience. Dr. Nikhil, I'll start with you. So, sir, what simple self-checks can someone do at home to understand their overall spine health?
So, for spine health, a person, a routine person, an office-going person in a normal routine life, if they are able to manage their activities regularly, अगर वो अपना सारा काम कर पा रहे हैं, they wake up in the morning, they take bath, they dress up, उनको कोई problem नहीं हो रही, they can carry weights around 5 to 10 kilograms to the office, they can travel comfortably in a car, long standing is not a problem for them. And when they come back home, they don't feel very tired or pain in the back. I think these are a good indication of a healthy life. If their weight is under control, they have time to go outside, they are able to go for walks, do some exercise over the weekends. I think these signs are good signs for a healthy spine.
Great answer, sir. Thank you so much for the insightful answer. Dr. Hamza, another significant and very frequently asked question coming to you. So, how much weight is safe for elders to carry daily without putting their spines at risk?
Actually, first of all, namaskar, a very good evening. This is a question which normally every patient try to ask in the OPD, how much I can easily, safely carry the weight. The thing is, there is no proper guideline in the Indian scenario, but in US there is a guideline for the US workers, and it states around 15 to 20% of the body weight they can easily, safely can carry. But iske andar bhi there is some catches there that how to lift it. That is very important. First of all, like a patient is of 70 kg weight is there, so he can safely lift 15, around approximate 12 to 15 kg. Another thing, how to carry it is very important. First, the weight should be proximal to the body, means very near to the body. And it should not be like lifting in a such a way that forward bending is not there that much. Means weight should be along the squatting type, so that it will be near to your body, so that gravity will be around there. So it put less strain to the back. That is very important. And another thing is, this thing is very important actually. And when they try to lift a heavy object, they should not reach out for a long distance. Weight should be near to the body.
That was a super detailed and super informative answer, sir. Thank you so much. Dr. Nikhil, other question goes to you. So, what lifestyle habits most effectively prevent spine degeneration and chronic back pain?
Yes, so I think the first thing, as everybody knows, is maintaining weight. It's very important to have a controlled body weight, not to have a big belly. Second is good food habits. You should be eating protein and calcium rich food. Third is exercise. People going to walks every morning, jogging, running, cycling, swimming, all these things. These are good for your spine. People do yoga. This is very good. Pilates, aerobics. This is all very good. For people who work in the office, I understand that they sit for very long, their working hours are extended, they're sitting on the computer all day. So using ergonomic chairs, trying to minimize stress on the back, using the chair for back support and distributing the weight and taking breaks in between. These are some good routine habits which you can bring into your life and take care of your spine.
Thank you for the answer.
Can I add one?
Sure, sir. Please go ahead.
So, like everybody is now becoming a more and more sedentary lifestyle.
Sure.
Like Dr. Nikhil very well told, ki one has to do aerobic based exercise daily. It is at least mandatory 4 to 5 days in a week.
Moving your body.
Moving your body. There is no doubt about it. 40 minutes aerobic based exercise. And jogging, simple jogging is very good. And like Pilates, Zumba, Pilates, these are very good. Another thing is like he told ki sitting, it should not be prolonged sitting.
Okay.
Even if you're sitting in a ergonomic chair, but if you keep on sitting for a long time, it is not good. Like earlier, it was a saying whether sitting is a new smoking. It's like this only. So one has to sit only at least 45 to 1 hour. After that, take a little break. 2 minutes break is enough. Stretch your body, sit again, start doing yoga again. That is very important.
Thank you so much, sir. And what I can gather from this is sedentary lifestyle should be avoided as much as we can. Another question for Dr. Hamza. So, which exercises would you recommend as the best for keeping the spine strong as well as flexible?
In general practice for everybody, like elderly patient also, young patient also, simple thing is to should go for walk, brisk walk, 40 minutes of jogging and 20 minutes of yoga. I normally recommend doing yoga Surya Namaskar. It covers both thing, walking and this thing covers the strengthening exercise also and flexibility. But if you ask me how one the best exercise for maintaining the spine strength, it will be a core exercise,
Okay.
core strengthening exercise. Because core strengthening exercise is very important because it gives strength to the spine itself and transmit the body weight also properly to the joints and ligaments, which put it less problem to the disc. So the spine health remain good when we have a good core.
Thank you so much for the answer, sir. Dr. Nikhil, another question for you. So, how can parents, they can tell if their baby or toddler is having back pain even though they can't talk about it?
So this is a very tricky question because kids don't know and they can't communicate well. And it requires very vigilant parents, parents who are very careful, they are well informed and they are always taking care of the baby. So if you're asking about babies like less than 5 years old, what I have seen is patients come to us, whenever the patients have come, they come with the patients complaining that they have noticed a small swelling in the back, or there is some prominence of the back, especially around the shoulders. Or they see when the child is sitting, he's sitting in a position in which the back is a bit different compared to the normal child. So like he's leaning towards one side or he's falling a little more. Then if you come to a little older age group, which is between 5 to 10 years or maybe up to the teenage, children usually complain of shoulder imbalance. They will notice there's a change in the shape of the waist. Some kids can also present with the fever and they feel like avoiding certain movements. Like if they have a back pain, they might not be able to communicate it well. But wo fir back ka use kam karenge, they will prefer to lie down. They would not like to play around well. They will start losing weight. They will get irritable. Some kids can have weakness in the arms or the legs. They will stop using that hand or stop using that leg. So these are very subtle signs which have to be very carefully picked up by the parents, especially by the parents who are having specially disabled kids. I had a patient who was a patient of cerebral palsy, means the patient had autism and he had mental disorders. It's very hard to communicate with those kind of kids. And that patient, I think he was Down syndrome, I'm sorry to say that. So these kids are very less talkative and all. And then the patient started to have weakness in the arms and the legs. Because the child, they were even, I think, by the time they reached the doctor, they were seen by a lot of other people like physiotherapists, and everybody thought that's just a routine general weakness. But when he was investigated, he had a problem in the neck. And a neck problem is very common with the Down syndrome. So it requires very vigilant and very well-informed parents to take care of the children and get an early treatment as soon as possible.
All right. So what I can gather from this is it all depends on the parents at this age because the kids are extremely dependent upon them.
Kids don't know anything. They are innocent. They just do whatever they are told. So it is important to have a good supervision and guidance.
Definitely. So Dr. Shaikh, would you like to fix it?
I just want to, with the help of this podcast, it will be good. A parent will learn something to you can say red flag sign to notice this type of problem. First of all, a toddler, whatever normal thing was happening with the child, like whatever behavioral thing, any changes is there, means something is abnormal.
Definitely.
Like he is having abnormal crying, not able, not letting others to touch the back. That means some problem maybe in the back. Earlier he was walking normally, now suddenly he started limping. That means some problem is there. So these things should not be ignored. For that, it's better to consult one physician or a pediatrician, anything, and if pediatrician definitely will evaluate properly and will refer to spine or orthopedician.
So the parents have to be extremely attentive in this case.
But mostly, most of the mother and child, if they know that any change in the behavior, they will understand. But only thing is in India that we have to, it is difficult to reach a proper doctor or for the same.
Definitely.
That is also a challenging thing.
And thank you so much for this session, sir, for the answer rather. So Dr. Hamza, recalling back your previous answer about the core strengthening. So can you please tell me how does strengthening your core helps protect your back?
Okay. So basically, core strengthening is a central part of the body.
Yeah.
I give you an example. Basically, you take it like this. This is core. Means front is the abdominal muscle, back is the spine muscle, upper is the diaphragm, and lower is the pelvic floor.
Okay.
So if these all are things are in tight or good strength, your weight transmission will be good through the spine. Okay, so it will put less pressure on the disc, less pressure on the joints. So weight transmission is good, so it will chances of injury to the back will be less. Okay, so like I give you an example. If you have a empty can, it easily get crushed.
Yeah, it does. It does.
When it is like this sealed, it is very difficult to press it. That is core.
Okay.
If
Like you could crush an empty Coke can.
Understood, understood. Thank you so much for the illustrative example. I'm sure it made our viewers help understand all of this better, in a better way. So, Dr. Nikhil, my next question comes to you. It is, what immediate first aid or home treatment should someone do after a back injury or fall?
So I usually recommend my patients whenever they come after a back injury or fall is first is rest. It is very commonly understood. Stop avoiding lifting weights. Stop doing things which are bringing the pain. Second is I suggest ice packs. In the first few days, I suggest ice packs to decrease the swelling, then painkillers. And if over the next few days the pain doesn't go away, or if it increases, or if it starts radiating, needs going to a different part of the body, and it is making you unwell, then I would suggest to consult a nearest specialist or a general physician, whoever is closer to you, and get guided to a proper specialty for proper care.
All right, sir. Thank you so for the answer. Dr. Hamza, a rather tricky question is coming to you. So, how do back pain problems differ between men and women, especially around childbirth or menopause?
So if we say back pain in women compared to men, men usually have more incidence of injury related back pain. Like they are lifting something or they are doing gym or they fell down. This type of problem is more, or simply you have heard about it, disc herniation or slip disc. It is more in men. But in women, chances of having pain during pregnancy, which obviously happen in women only, not men. Other is postpartum period. Third is when menopause happens. So this thing is obviously specific to the women. Why this happens, I will tell you. Most of the patient, like during, even after postpartum, after 2-3 years of the pregnancy also, they come that we had an injection in the spine for the cesarean, that's why we are having back pain. The reason is something else, I'll tell you. And during pregnancy, first we'll start with that, because in belly, baby has to accommodate, the weight will increase, overall weight is increased. So center of gravity is shifted little forward. The back muscle has to work more, first thing. And the time of delivery, what happens, it is the hormonal issue that body secretes relaxing hormone. So what is relaxing hormone does? It relaxes all the joints in the pelvic area, in fact all the body also. So specifically in the pelvic areas, it is a natural process because baby has to come out. So because of ligament laxity, means ligaments become loose, it's state of little instability to the spine. So that's why chances of back pain is there. So what happens after the delivery? So normally 40 days is enough, when everything should settle down again. But what happens in India and in other parts of also, that women didn't get time to, mother didn't get time for proper exercise also. They again go to the household activity or maybe in the work. They're not able to give proper importance to the exercise. So pelvic floor, like I told you earlier, the core will remain weak. So that's why they experience during pregnancy, post-pregnancy, this type of back pain. Another thing is psychological pain in women is more compared to men. Like most of the patients will come with cervical pain, hair pain, it goes to head. It is mostly related to some underlying stress related. So that is the problem. Third, now in the time of menopause, what happens in menopause? Estrogen levels reduces in the body. So what happened? It increase the bone degeneration. Means bone mass will decrease. Disc degeneration will increase. So it leads to osteoporosis and other spinal problems. So that's why women has more chances of back pain compared to men.
All right. Thank you for the answer, sir. So, Dr. Nikhil, we have always heard people around us raving about good posture. Sit straight, stand straight, move regularly. Everyone says good posture is important. So, in this very light, my question to you is, why are good posture and regular movement so important for long-term spine health?
So to understand this, we need to understand the anatomy of the spine. The spine is made up of 24 bones which are mobile, which are moving with the help of the discs in between. The spine is a combination of bones, discs, muscles and ligaments. So the bones are the solid part which can only break or they can give you strength. The mobility and the flexibility comes from the discs, ligaments and the muscles around the spine. Now discs are the shock absorber and they provide the smooth movement. And then the muscles and ligaments are the structures which control the movement wherever you want to, whichever you want to do. So if we maintain a good posture, because every human being has a limited amount of tissue, the length of the each ligament, length of the each muscle, the height of the each body and the amount of disc is fixed for anybody who is born. So if we are maintaining a good posture, we are taking care of the spine, we are putting less stress, we are keeping those ligaments and structures within their limits because every structure has its natural strength and the stiffness and elasticity and its limits before it can break. So the way they are made, a natural human spine is made to make you stand straight because the pelvis is tilted, the hips are tilted towards the front. So the spine is shaped in such a way that the lower back is curved backwards, then the upper back is curved forwards, and then the neck again takes you back. So for each section of the spine, every structure has its own properties, its length, its strength. So if you maintain a good posture, we take care of all of these things and avoid the injuries. It's just like having a car. आप regular service कराते रहोगे, ज़्यादा जोर से ब्रेक नहीं मारोगे तो उसका क्लच कंट्रोल में रहेगा, उसका ऑयल बार बार नहीं चेंज करना पड़ेगा, ब्रेक्स अगर हल्की लगेंगी तो टायर ज़्यादा का ट्रेड बचा रहेगा. So it's just like that.
So, in layman terms, what you're trying to say is good posture and regular movement is like servicing for the body.
Taking care of your body, yes.
Okay, great. Thank you for the answer, sir. So, Dr. Hamza, surgery is unfortunately still a term that we tend to avoid. If someone, says you will have to go through a surgery, people still get scared. I still get scared. There is no denying that. But however, there comes a time when surgery has to be there. You have to perform a surgery after all. So in this very context, my question to you goes something like this. So when is it really time to consider spine surgery and what should patients expect from that?
Good. So first of all, we have to understand some red flags or you can say type of back pain.
Yeah.
I will give you in a brief. So most largely whatever pain we normally have in day-to-day life is mostly coming category of mechanical back pain. What is mechanical back pain? Like you got up in the morning and doing some work. After some work you start having some tiredness in the back pain is there. When you lie down, the back pain becomes better. So this comes under the category of mechanical back pain. So this pattern of pain is actually natural. For that, whatever we have talked in last half an hour, we have to posture this thing. So this is not a concerning thing. Red flags is when the pattern is changed. Like even after lying down, you are having pain. In fact, it get increased. So this is not normal. Even you are lying down having rest, but your pain is increasing. So this happens rarely. This is in some rare category. It's not you find it day to day, like in infection in the spine. this type of pattern is there. When cancer in the bone, spine is there, this type of pattern is there. Other is definitely if any injury is there, fall from height or road traffic accident, pain in the back is there. That means it may be serious thing. You have to consult doctor. In elderly patient, everything was going good, but suddenly in one day you are having severe pain. In old age and in child, if patient is telling pain, then you have to take it seriously. Because normally like child don't tell pain and elderly don't normally. Sudden pain means some problem is there. In rest of the thing, which is covering the 85% of back pain, you don't really need to go for back pain every time to a doctor. So normally what happens, their body has a healing time. Like generally somebody catches a back pain is there. So it will get heal in 2 to 3 months. Maximum I'm telling it. Okay. When it is not healing or it's not improving with medicine, with rest and even with some physiotherapy, that means some problem is there which is not getting better. Body is not able to heal in itself. So in that definitely you need to consult a doctor. So in that case, in that also we largely like you have heard about a disc herniation and spinal stenosis. In that also I tell every patient that 85% will get better in 2 to 3 months of time. There is no need of surgery. I'll tell every patient. Even the cervical has better chances of getting better. But if it is not getting better in 2 months of time, and additionally if somebody has a weakness, means neurological weak, leg become weak or hand is becoming weak, in such condition, unfortunately, surgery is the last resort. So in that condition, you have to consult doctor. But largely, again and again, I'm telling, if you maintain a good lifestyle, healthy lifestyle, including good diet, regular exercise, proper sitting posture, an important thing which is missing nowadays is good sleep.
Definitely.
Good sleep. Good sleep is very important. It reboots your body, mind also, obviously. So in that case only surgery is required.
All right. Right. So the insights you shared were quite helpful and easy to understand. Now, is there any additional advice that both of you would like to share with our viewers about keeping a healthy spine as they age or even at a young age?
So from my side, I would suggest that so spine is something which improves the quality of life. So spine is not a life-threatening disease. Any problem in the spine is rarely it is life-threatening. So for any person who is active, who has been working on his life, so spine becomes the core. And from my experience, I feel a patient, anybody who is having a good spine, who has got treated with spine, has come back to active life, he is very happy. So if you have any spinal issues and you feel that your life is getting affected, I think you should consult a spinal doctor. Even if it requires surgery, you should not shy away from it, because nowadays we have very advanced equipments, microscopes, lights, instruments. It is very safe, and doing a surgery can bring you back to your feet very quickly. We mobilize the patients from the next day. They go back to a routine lifestyle. So don't be afraid of a spine surgery if you want to stay active. But of course, the decision depends on everybody. I would like to talk about some gym. Gym is a very common thing nowadays. Everybody wants to stay fit. But if you're going to gym, I would suggest to avoid heavy weights. You do aerobics, you do cardio, you can lift weights within the limits, but heavy weights can have counter effects on your spine, because the more weight you lift, the more pressure you're putting on the spine. And it is very common for gym goers to have prolapsed disc, and then they come back with leg pain and weakness in the legs.
Thank you so much, sir. So
I just want to add for the gym part, it is becoming increasing very common. Actually, I have told my patient, don't do deadlift, don't do weighted squat. Unless and until you are doing it professionally, then go ahead. Otherwise, if you are doing for good health, stop doing that, because most of us don't have a proper trainer with us. And in most of the cases, a patient will, sometimes injury will happen. So it's better not to do these two exercises. Rest you can still do, weightlifting also, but deadlift and weighted squat is too dangerous.
wonderful advice, sir. Thank you so much. Thank you, Dr. Hamza and Dr. Nikhil, for joining us today and sharing these brilliant and easy to follow suggestions. And to all our viewers, take care of your back, stay healthy, and see you next time.